Wellbeing Board. My name's Phil Glanville, I'm the Mayor and in the Chair. We have an absolutely packed agenda today, as I'm sure people have realised. So my notorious chairing will need your help, but I do want to make sure that we do give the different items justice, especially as we've got so many people from outside the organisation presenting and contributing, and obviously they're key members of the Health and Wellbeing Board and the local health system. This is obviously a hybrid meeting, so colleagues, predominantly councillors and senior council officers, are in the council chamber, but there are colleagues obviously joining virtually. In terms of attendance and counting, only the people in the room formally count in the attendance. If people that are here virtually can mute themselves unless speaking, and whether you're in the room or virtually, if you can raise a hand if you want to take part in the debates and discussions. And please only use the chat function for any IT issues or trying to get hold of me, the clerk or the chair. Beyond that, I think we can proceed. The following members are present, which is myself as Mayor, Councillor Kennedy, Councillor Bramble and Councillor Vajana Thomas. My understanding is that Deputy Superintendent Dan Rutland is attending from the police, and that James Goddard is deputising for Stephen Haynes, and that I've got apologies for absence from Councillor Williams, which is unsurprising given the amazing jobs fair we've had in the building this afternoon, Paul Senior and Raj Vadir, who is our pharmacy representative. Do we have any other apologies for absence? No, thank you. Anyone in the room, anyone virtually? Thank you, Deputy Mayor Bramble. Anyone else want to pass on any apologies in the virtual room? No. Okay, so we want to appoint the following new members of the Health and Wellbeing Board, which is Paul Senior, who is the Interim Director of Education here at the Council, Mary Clark, who's Director of Nursing and Corporate Development at the GP Confederation. I think, will note and thank Annie Gammon, who was our previous Director of Education, for her active participation in the Health and Wellbeing Board, and also Laura Sharp for her, not only I think her contributions to the Health and Wellbeing Board over the past few years, but her contribution to the GP Confederation, and a critical part both of them played in our COVID response. We will be having other colleagues joining us in future meetings, as we've got some churn in partners at the BCU and the Fire Brigade, but they will no doubt join us at future meetings. Are we happy as a board to appoint those following members? Agreed. Fantastic. So item number 3 is declarations of interest. Are there any additional declarations of interest? They're in my council declaration, I think, but I am now formally a member of the NEL ICB. I'm not sure the last time I sat in this chair chairing the board that was the case. So I'm delightfully dual-hatted later on in the proceedings. But if anyone thinks I'm stepping over either line, just jump in. But I think it's fine for me to chair that section of the meeting unless someone says otherwise. Item 4 is the draft minutes of the meeting of 22nd September. I obviously wasn't here or in the chair, so thank you to my co-chair, Steph. Does anyone want to pick up anything in the minutes that aren't in the action tracker? No. Okay, we're happy to agree the minutes. My understanding is that Dr. Husbands, you've exchanged correspondence with some of the residents that attended the last meeting, and I think contrary to some of the public debate on the subject, that was quite a comprehensive letter that you sent them, but I don't know if you just want to add for the sort of public record.
Yes, thank you, Chair. So I did write back to one particular resident who'd contacted me direct. We had a number of questions which were in a similar vein, and quite a lot of work has been done in putting together a response to each of those, which are will be ready imminently and will be sent and can be appended to the minutes of the subsequent meeting.
Thanks very much. That's much appreciated. So subject to that, and we might add that to either the minute or an addendum to the pack that goes out next time. We'll agree with that. So we've got the action tracker, which we've got action 1, which in earlier discussions I think came about as a result of the discussion at Health and Wellbeing Board that involved possibly Health Watch, but Donna, I think you're following up with housing colleagues.
Yeah, there's 2 separate sort of quite outstanding actions on the action tracker 1 and 2. 1 is related to health and housing presentation that was given at the board last year, and we're following up with housing colleagues for an update that the Health and Wellbeing Board requested. So I've followed a new lead this week, so hopefully I'll be able to provide an update on that at the next board meeting. And then we are following up with Health Watch colleagues as well on action number 2. And then action 3 is going to be booked in to a Health and Wellbeing Board meeting in 2023, and action 4 is nearly complete as well. And that's it, there's only 4 actions. And then just to say as well, there was a question from Susan Masters about pharmaceutical needs assessment in the last Health and Wellbeing Board meeting, and that's the answer to that's been sent to Susan now, and it's been appended to, below the action tracker on the agenda pack as well.
Great, thank you, Donna. I think I heard a virtual hand go up. Maybe I didn't. Sorry. Thanks, Susan. Thanks, Donna. It's in the chat. So we're happy to agree those actions, that they're on track. Good. So item 6 would be questions from the public. I'm advised that there have been no public questions for this meeting. We've obviously referred back to the previous 22nd September public questions, and they're going to be included. So that slot on this occasion, I think, is redundant. So moving on to community voice, cost of living crisis. So I hope that we've got Sally from Health Watch with us. Welcome. And you were here at the last meeting I chaired as well, so that's great. And obviously we've got a bit of a theme around the cost of living crisis this evening. I'm going to hand over to you rather than doing a big introduction, and thanks very much for coming.
Thank you very much. We've done a little bit of work around cost of living, and I know it links into some later items on the agenda. Health Watch thought it was quite important to try and capture not just kind of the statistics, but actually what are people telling us? How are they feeling about the cost of living crisis at the moment? This is a piece of work that we're building on. We've started off with a survey, and although I'm saying a survey, it's not just we put it out digitally and people sat at home. We've gone out and outreach and talked to people and talked them through as they're doing the survey to help them really capture their experiences. At the end of the presentation, what I want to ask from you guys is what is useful for us to do next. We want to build on this piece of work. We want to potentially target particular groups to talk to them and ask them the right questions to bring something that's maybe valuable to members in this room and people on this call. So, just referring to my presentation, we know that health and well-being of people is suffering at the moment because of the cost of living. We went out and spoke to 56 local residents to ask them what is their experience now, how is it affecting their mental health, their physical health, what can we maybe do to help. We spoke to quite a wide demographic of people. Quite a lot of the people that came forward to talk to us were over 60. So they obviously felt that this was quite relevant to them. We've captured quite a broad demographic of different ethnicities, slightly more female than male came forward to talk to us, which is often the way. And interesting to note, people that were talking to us and telling us that they're struggling with this quite a few of those people are employed. It wasn't people just living on benefits that are struggling at the moment with the cost of living crisis. Of those 56 people, 89% told us that the costs are already having an impact on their lives. 81% told us that they're less able to afford additional purchases than they were this time last year. But most strikingly for us, 61% of the residents we spoke to told us they're already struggling to afford essentials. So what was really coming out of this was almost having to choose between food and electricity. We can't afford both at the moment. And for over half the people we spoke to be telling us we feel things are only going to get worse, not better. So really, I wanted to capture some of the things that people told us because it was quite striking. You know, bills keep going up and income is not going up. It's a catch-22 situation. You want to keep healthy, you want to eat well, and you want to have, and if you have certain medical conditions, you need heat, you need hot baths, and it will have a great impact on my health. Prioritizing and paying utility bills means pulling back on purchasing things that make me happy and adds a focus on my survival. This is impacting on my mental well-being. I have a disability and everything is expensive now. I'm on a benefit, but I'm still receiving the same benefit, but everything has become so expensive to afford these days. So just some examples. And we asked people, how is this specifically affecting your health, your well-being? And they told us, I feel more stressed. I'm wondering what happens if I get enormous heating bills that I can't pay. I feel stressed all the time and panic every time I have to spend any money. This is causing my mental illness to significantly worsen. Mentally affected, I feel broke all the time. I just can't enjoy myself. It's affecting me and I'm taking more medications for it because I'm stressed and depressed and I have anxiety. So it was really clear that people's mental health is being affected already by this, as well as their physical health. You know, comments like not being able to buy healthy food, having to give up my gym membership. And in particular, we were struck by hearing from people with serious or long-term health conditions. I'm a patient who's already suffering from kidney problems and diabetes. This means that with the high rise of food, for example, I can't support myself, especially because I have a special diet. My benefit's not gone up to help me manage that. Recovering from cancer and suffering from arthritis, I need a warm flat, otherwise I'm in pain. Stress, I've just had cancer and I have MS and I don't want to put the heating on, even though when I'm cold in the house in the evening. I'm suffering from lack of sleep, tension headaches, occipital bone tension and body aches. So I think that's potentially a group we'd like to find out more from, people with long-term health conditions, and if there's any extra support we can offer them. We asked people what might help. Overwhelmingly, energy efficiency advice or any kind of offers around more energy efficient appliances. It really seems like electricity is one of the most striking costs for people. The next highest thing that people spoke to us about was help with home budgeting, advice around debt management, knowing who to go to talk to say, I'm struggling to manage my finances. How can you help me understand how I can do this better? So we had some other suggestions from residents, and some of them were actually quite easy fixes maybe. Things like, could we not have a handyman to come round to service my flat and fix drafts? Could we have someone to come and insulate my windows? There was a comment, Meals on Wheels with a fee as soon as it's nutritious and hygienic, and that would feel like emotional support as well. So there were quite a few comments around that. So this, as I said, this report's the basis of a wider piece of work. The key themes that are really emerging that people were saying to us would help is the need for energy efficiency advice and schemes that can provide energy efficient appliances, help to insulate properties. People spoke to us about community meals and kitchens and drop-in centres, as well as food banks, and increasing their availability, and perhaps something about raising public awareness of where the services are available. People are asking for home budgeting advice and debt advice. And what struck us is we think there's probably quite a lot of things out there that exist that a lot of the people we spoke to didn't seem to be aware of. They were telling us we have a need for something and we were able to signpost them and say, well, actually, we think that's already going on. So it could be that there's quite a lot of focus on not just what are we doing, but how are we making sure that people that aren't necessarily linked in with us know that these things are there to help them. So that's a brief summary of what people are telling us. Particularly interested to find out if there's time, if there's any themes or areas or groups of people that it would be helpful for Healthwatch to take this work forward with. And just to let you know, we're going to be doing this work over the next 6 weeks or so, but we plan a session with the older people's reference group on the 1st of December, because that older people are coming forward talking to us. So we're definitely going to go a little bit more in depth with that group of people, but interested to know if there's anything else we can do that would feed into work that's already going on.
Thanks very much, Susan. Really important contribution. I think fits within the themes that are building towards the cost of living summit that we're hosting later on. I saw some hands go up. Susan, there's a lot of Susans here that are wanting to come in, so I might go for Councillor Joanna Thomas and then Susan virtually.
Chair, thanks, Sally, for this. It's quite interesting to read this. Just 2 quick comments and just responding to what you've asked us, taking this forward. In terms of your sample, I noticed that you have quite a lot of people above age 60, which might be many of them would not be working age, probably over 70, and going by the fact that it's being said that high cost of living will impact people on low income, in work on low income disproportionately. I'm not too sure if when you're taking this forward, if those cohorts, there can be a sort of focus on those cohort people that in work but on low income. And the other thing to point out is around the recommendation. I would love to see something around, you mentioned mental health, panic, stress, around building resilience, helping people to build resilience won't make the problem, the challenges go away, but it helps in terms of addressing those mental health, forming positive relationship, being hopeful, looking forward to this will pass, sort of. So it would be good as part of taking it forward if that can be considered as well. Thanks.
I absolutely don't mind, whichever is best time wise. That's fine. That's fine. Yeah.
So firstly, Sally, thanks a lot for a really informative report. From my point of view at the moment, we're carrying out a similar piece of work within Hackney CVS, looking at the impact of the crisis on the voluntary sector, because just like residents, you know, our organisations are seeing their fuel bills go up, they're seeing demand go up, but they're having to sort of deal with all of that with the same level of funding. And I'm sure this evening at the panel you mentioned, our CEO, Tony Wong's going to be talking about a lot of this. And we are at the moment in the process of sort of capturing the experiences of voluntary sector organisations and where their particular challenges are. So we'd welcome the opportunity to bring our own paper to the Health and Wellbeing Board maybe in January. We're sort of aiming to produce a report on the impact of the VCS and what's needed to build resilience, but also look for solutions within our sector for voluntary sector organisations to offer sort of training and support to other voluntary sector organisations. But I guess my question for Sally is, was there anything that surprised her and Healthwatch in what they heard from the residents?
Great set of questions, Susan. Any other questions or comments in the room? Chris.
Thank you. Just one quick one. I know Healthwatch is a national organisation. I wondered if similar surveys were being done elsewhere and if there was a way in which you could coordinate them so that you might be able to bring out something that is specific to Hackney only or parts of our communities.
Thanks, Councillor Kennedy. Any other questions or points? I'm assuming, Sonia, you'll be able to weave in sort of points of shared interest and onward journey in the next item. I don't know if you've got any sort of comments though.
Yeah, that's why I didn't put my hand up, because I thought it was better off in making notes to pick up. But thank you for that.
Thank you. Rosemary.
Thank you very much. Good evening, everyone. I've been pondering about what would be helpful in giving feedback, aside from, in addition to the information that we've had already. And what I'd like for the board to consider is the impact that cost of living is having on relationships within the home, particularly people with mental health. And to be more specific, I have a family who are experiencing really acute difficulties with caring for the husband, the father, who has dementia and is not receiving sufficient care. So it's incumbent on the family to do the best that they can, and I mean that in stark terms. However, because let's say the routines and the way in which the family have been able to manage things up until the cost of living crisis is really beginning to dig deep, the male in the household, the husband, the father, is becoming more and more confused, and to the point where it could be quite dangerous, because he's in the habit of just wandering off out on the streets, and the obvious concern and anxiety that causes. Sometimes the family have to go out and look for him, and other times he'll just turn up. But it's just really to say that there are different layers to which the cost of living crisis is, there are very nuanced situations that are actually taking place within households, that because of the stress, the anxiety, the change in sort of diet and routines and so forth, is affecting the most vulnerable people in ways that it would take some, a good deal of thought and consideration to how we can support this, because resources are very stretched, and it's something that's worth recording and looking at what we can do in this sort of in these kinds of scenarios. Thank you very much for listening to me.
Thank you, Rosemary. And I think that layer of complexity in the human experience with people who are already challenged by resilience and multiple needs is very powerfully made. And if you look at some of the testimony within the Health Watch report, I think you see some real synergies. I was just going to ask one final question before putting it back to you, Sally. Is the cohort you were talking to, there's a sort of demographic breakdown here, but are they sort of active members of Health Watch, people that you're aware of and that are close? Because I suppose there's part of what we're trying to do, and it'll be a reoccurring theme, is use our sort of trusted partners to get key messages out to people. There's obviously the Help at Hand booklet, there's the advice network. Health Watch is a sort of statutory partner, so if they are known to you, what can we do to empower Health Watch as an organisation, recognising you're not an advice organisation in the way that some others might be? So yeah, help for you, the demographic question, and then I guess if you are going to continue that work and HCGS are going to continue that work, is there something we can do to sort of shape a single set of questions, or at least a core set, that when it comes back here and comes back to sort of Sonia and the team, it's looked at some of those gaps? And I think people with long-term conditions on the edge of care sounds like it's a good area to sort of explore, perhaps, especially those on fixed incomes. But back to you, and thank you very much for how far you've taken it already.
Thank you very much. And I'll answer your point first, and then quickly work through them. People we spoke to were a mixture of So some from groups that we already know, but quite a few where we did outreach, and so we were meeting people for the first time. Now, one of the things that could be really useful actually is by doing outreach this way, when we meet people for the first time, one of the things we ask them is, would you like to sign up for our Health Watch mailing list? We'll share newsletters with you, we'll share updates. And by using the opportunity to get them linked in that way, that increases the network of people we're reaching. So if we can then use that network to make sure that we're sharing any relevant messaging, any useful signposting, and we are a signposting organisation as well, and we get people phoning us up when they're struggling. So making sure that we know where we're signposting, whether it's having a list of food banks, things like that, or whether it's debt advice, making sure that we've got the most up-to-date signposting information that we can share, one for our MailChimps and our website, and two, share with individuals when they contact us. I think that would be really, really helpful to do. Thank you. Working through the points as well, I really like that idea of resilience and focusing on people on low incomes. That's good to hear you say that. We've had in mind linking in with supermarkets. Often we might go and do engagement, and we're engaging with customers at supermarkets, but actually to target those kind of organisations that say we would like to link in with your centre, I think would be really good with this piece of work. So thank you for that thought. Susan, you asked, did anything surprise us? I think we were taken aback by how many people we already felt listening to them speak. We're in a position where they felt they had to choose between electricity and food, given that this work hasn't taken place in the coldest months of winter. It's not really started getting cold yet. So those costs around heating and electricity are only going to go up. So that, I think, we knew it was going to be high. We didn't realise it was going to be as high as that. And I think we weren't anticipating that feedback about people with long-term conditions and how already this is really affecting them, given that the weather's not got as cold yet. So I think that the thing that surprised us was we're hearing feedback now that I think we thought late December, January we might be hearing, which made us think, where are we going to be late December, January if things don't improve? Chris, really good idea, linking and finding out what other health watches are doing. Nationally, yes, but in particular linking in with the 8 health watches that make up North East London, that could be a really meaningful piece of work. So I will take that away. I will find out what other health watches are doing. Thank you for that brilliant idea. I like it. And is that all the questions? Rosemary, yours is more a comment than a question. I completely agree, and I think as well as this kind of outreach survey kind of work, we would like to do some more, possibly one-to-one kind of empathy interviews or focus groups, perhaps to explore those more nuanced impacts which don't come across as well maybe in the surveys. Have I missed anyone, or it all?
I think that's been quite comprehensive. What you probably can't see in the chat is Susan followed up sort of my suggestion, and I think you're welcome to it. You welcomed it as well, about a sort of set of questions that might be useful, or just at least comparing notes as the two pieces of research continue. I think that linking to North East London Health Watches is great, because that will then maybe appear at the NEL board, because obviously Health Watch is represented there, and they're looking at their own cost of living response, both the staff and the system. So I think that's really good and quite comprehensive. So thank you. I don't think there are any other points that were not covered. My only other point I'd be quite interested in is whether falling between services, and obviously your nexus is at Health Watch, so looking at the health system, not just looking at kind of the council partners and government response, is if you're finding vulnerable people that are moving between different settings. So they've been to see their GP, they've come to the council, and what that insight is, because we're hoping to obviously join all this up and make sure that everyone knows where to signpost people and hold people. So I think just tracking that would be super useful when I think about what we're trying to sort of build. And I know that there's a real focus across the system. But thank you, and look forward to hearing more. I know it's a very bleak picture, and I think your caveat there at the start, this is insight looking backwards. It's been up until very recently fairly benign weather. Many of the fuel rises hadn't taken place, and inflation continues to rise, and obviously bills will rise across the winter. And that's a sobering thought, I think, exercises all of us. So should we move on to your presentation, Sonia? And some of that will obviously be a response to this, but obviously it's also our strategic response so far. So thank you.
Thank you. And I haven't got a presentation. I was going to assume that the report's taken as read and go through some particular points that bring it to life in terms of how we're mobilising and accelerating our response to the worsening crisis, and also draw out some key points about how we can continue to embed this in the work of the Health and Wellbeing Board. So the report sets out that the framework was adopted in March for tackling poverty, and you'll see that that report is about how, sorry, not the report, the actual framework is about how we respond to both the pressing material needs and the longer term work that we need to do to address the real drivers of poverty, because we need to always keep reminding ourselves that many Hackney residents have been in a cost of living crisis for many years, driven by housing costs and driven by wage stagnation, so wages being kept down. And this is just now entrenching those people into an even worse position and bringing more people into poverty as well. So those long-term drivers around housing, good quality employment, you know, kind of making the case for a benefit system that works so that work can work are all very important to look at, alongside a response that is about pressing material needs. And actually, if we don't respond to the material needs, we're not being preventative. It's not one or the other. Because if children are going to school and they're hungry and they can't then be educated, then that's their lives destroyed. So that is preventative. And also, you can think about embedding a more preventative offer into any short-term intervention. So you're trying to switch from what could be a simple handout to actually trying to maximise the benefit of that relationship, that interaction, and then that brings us to, well, who's best placed to do that sort of work? And we learned a lot of that from the pandemic. You know, is it best to deliver food parcels in a highly transactional way, or is it best to work with the voluntary and community sector who are there all the time on the ground, fund them to do that work so they can build the relationships, they get to know who the vulnerable people are in the area. So that's the framing of how we approach the poverty reduction framework. It's really important to stress that we need to work across the whole system and join up existing work on the ground, not try to see this as something unique and different. I think some of the examples that were brought to life in the report from Health Watch, and also point was made about dementia, I think they really show the importance of working across the system, because we are talking about real complexity in terms of people's lives and also the multiple needs. And if we're not working with the right people, we won't reach all of those people. We won't reach them in the right way because we'll have a uniform one-size-fits-all approach to that. Also, that's the reason why we've got a very strong political leadership, so that we are ensuring that cross-cutting response is there. So the Mayor has an interest, Councillor Bramble has an interest, but then we have 4 cabinet members who steer the work, and 2 of them are here, Councillor Williams and Councillor Kennedy, Councillor Woodley and Councillor Chapman. So then that covers, as you can see, a lot of span of the council, from employment through to health and wellbeing, through to children, child poverty, and customer services and benefits and financial support. So the focus of the report which I provided is objective 3 of the framework, and how that's been mobilised and accelerated, because that's the part of the framework which is about meeting people's material needs and the practical support that we can put in place. So emergency support and income maximisation, continuing to work with that voluntary and community sector partnership. I talked about how we valued that during the pandemic as a council, and actually intentionally kept that partnership, well, intentionally worked that way during the pandemic, because unfortunately we knew that we would still be in this situation coming out of the pandemic, but obviously I don't think anyone could imagine the cumulative impact of various crises that have led to where we are today. And then the system-wide plan, which picks up on I think the opportunity that picks up on the issues we're dealing with institutionally in terms of our own staff needs, and also service viability. So actually by bringing people together as a whole system, we can tap in and maximise what needs to happen on the ground in services, but we can also understand and work together on the impacts on our institutions. So key points to make today to draw out from the report. First of all, just to get across really clearly that the poverty reduction framework was deliberately working with the complexity, and so we've set out very clearly how health is impacted directly and indirectly by poverty, and how the two interrelate as well. So how, if you've got long-term health conditions, you can end up in more poverty, but also how poverty can impact on your mental health. It's just two examples. The report talks about how we've been working with the Health Place-Based Partnership, chaired and with the director, Nina, to make sure that we've got that system-wide approach. And we will continue to do that, to work closely with colleagues across health and in public health. In terms of thinking about a system-wide plan, we've just deliberately not brought together a council group as a council working group. We've brought together a system-wide group. They meet for the first time next week, chaired by Nina. And actually looking at the terms of reference that my office has shared with me, my immediate reflection was that we could well open this up to a wider membership. But actually, I think we need to get started. And then we need to think about the relationship between that and the Health and Wellbeing Board, because it might be that we report, we utilise the wider, that we work with the wider system that way, rather than trying to keep bringing people into a one system-wide group. So there's a role for the Health and Wellbeing Board in that oversight potentially, but also the longer term work, because I talked about that, how we need to keep our mind on the drivers of poverty, which are also the wider determinants of health and well-being. So actually having a way of reporting for the whole framework with the Health and Wellbeing Board and situating that would be really helpful, because at the moment, having a poverty reduction framework is helping us to keep in mind that bigger picture, but it's really hard at the moment. Everybody, it's helping us to avoid completely firefighting, but it is also really, really hard to actually work across all of the objectives of the framework proactively, as we would if the officers who were, should be doing that weren't trying to galvanise a coordinated frontline partnership approach as well. So having that opportunity to situate it in the Health and Wellbeing Board would help us to keep on track. We've also invited people from health, so Anna Garner, for example, to join, to work more closely and collaboratively in the lower level groupings that we've got. I want to make the point at the NHS that the place-based partnership has already funded parts of the work that were reported in the paper, and that shows how important it is to try to maximise support. So the Money Hub, which is set out, and also the support for voluntary and community sector organisations, just to shore up that support over winter. And then in terms of specific themes that would be worth strengthening through coming back to the Health and Wellbeing Board, I mean, obviously there's the theme around financial security, the fact that's a shared priority with the Health and Wellbeing strategy, and public health colleagues have been involved in the development of the framework and in the ongoing virtual team working, and the same applies for scoping out that, but I think we could do more to see them as fundamentally connected. And fuel and energy efficiency has been talked about today. Actually, that's an example of why it's important to work across the system, because there is some work that's been commissioned within the council, but from a sustainability perspective, but we're now working with them to see how we can get that organisation to deliver outreach and how it can be more tied to the poverty reduction work. But I think, Sally, that theme about energy efficiency advice, not just help with fuel, but energy efficiency advice is one that that again could be looked at. And then the long-term health conditions, the multiple needs, a deeper dive into how that interacts with poverty would be helpful. So I'm happy to take questions on the actual practical support that's set out in the report, but I wanted to go into more of the opportunities for us to continue to work with this governance. Thank you.
Thanks very much, Sonia, for that overview and the detailed report. And obviously it moves all the time as well. The work's sort of churning through in the background, and we'll hear more about that tonight at the Cost of Living Summit.
I skipped over the health and wellbeing point because I just wanted to come to that in the end, and then sorry, I shouldn't have done that. I just wanted to say thank you to Health Watch Hackney and to the residents who shared that insight, because we've done that sort of work before to get lived experience, and it's really hard. And actually we wanted to do that again over the last 2 years, but we've been reluctant to ask people about impacts when they're facing so many impacts and finding the right time. So it's really valuable you've got that. I think that you can't get away from that qualitative insight in terms of finding the right solutions. So I wanted to thank you for that. I've shared it already when the papers went out with people in my team, and you know a lot of them anyway, but ask them to connect with you. But in the meantime, to use that insight immediately so we can start to draw on that. So thank you. Sorry, Claire.
No, and you know, the key questions is, you know, what do we want from health and wellbeing partners in relation to the work? And I know some of the onward partners aren't with us tonight in their strategic leaders in terms of Fire Brigade and others, but there's also, so there's the feedback element, and I guess there's a steer between the governance structure for the poverty reduction framework that sits within the council, the 4 cabinet members, myself and others. There's the system governance in the place-based partnership, which is obviously funding, contributing to Money Hub and the community partnerships work, and then there's us with our own inequality focus and kind of poverty reduction, the financial impact on health. So it strikes me we're all wanting to see the same things. It's tying those bits together and in crisis, as well as looking at the long term. And I think the really powerful thing from what Sonia said is we have that immediate crisis response, but we're also looking at long term poverty reduction. Do we have any questions or comments? I'd like to thank the Health Partnership for making that investment in this response. I think it's really, really important. That shows the strength of our relationships. I've got Deputy Mayor Bramble and then Dr. Aspens. Deputy Mayor Bramble.
Thank you, Chair. Just to thank Sonia and the work of officers and members on this piece of work. It was just more a reflection on how do we as an organisation ensure that the principles of working together sit within the framework, given the challenges that Sonia rightly mentioned, because I think that we all want to work together, we believe in working together, but actually when we get down to the day-to-day runnings of a very big and large organisation, some of that can be more complicated than one can think. But I'm just reflecting on when we heard from my colleagues speaking about people with dementia, we can't be reliant on people coming forward to tell us that there's an issue. If you have dementia, you may not remember. If you are disabled and you are not physically able to get out to speak to someone, you may not. And also we've got to remember that sense of pride. Some people will find it quite embarrassing and uncomfortable as well to go out and seek help. It's only when someone goes to them or maybe mentions something to them that they will say, actually, I do need that support that you're offering. So it's just a point of reflection, Chair. How do we ensure the principles of working together are embedded in the framework that we're all working towards?
Thanks, Deputy Mayor Bramble. Dr. Aspens.
Thank you, Chair. I have a similar point in a way, but it was more of the practical advantage of the fact that we're a partnership and work together, and we will often all agree at this level that there's something that we need to do together. And the issue here is really that in very real time we need to make that operationally practical, the working together. We have some structures like our neighbourhood teams, which is one way of being able to share or work together around particular individuals or families who are in crisis and have need. But we also need to think about how we are sharing information about people, particularly people who are going to be quite vulnerable this winter, because of the cost of living crisis and compounded by potential energy shortages, and who is going to be most at risk. Very concerned about feedback, through the Health Watch survey, people saying that they're not going to turn their heating on. So they're not just putting themselves at risk of cold, but over the longer term of risks of exposure to mold, for instance. And it's really difficult if people can't afford things. It's a relatively easy idea to not put the heating on without necessarily understanding all the consequences. And it's a very easy idea for us to say, we've got an energy outreach, but how can it be most vulnerable from the impact of not being able to have their heating on, rather than, as Deputy Mayor Bramble says, waiting for people to come forward for help.
Sorry, you might not have heard me. You shook your head, but you've got your hand up, Nina. Sorry.
I think everyone on screen you went silent for a minute, but I think we can hear you now. Do you want me to come in?
Yes, please.
Sorry, thank you. So yeah, I think I just wanted to make a comment about kind of why I think we need a system response to this, and it also alludes to the 2 points that have just been made. I mean, this is a really wicked problem. It's a huge challenge, but I do think it's something where we really do need to maximise the benefit of a partnership response, because I think collectively we need to maximise the benefit of, firstly, everyone in, all of our frontline staff across health and social care and wider services being able to identify the risks, and what people could be, risks that could be facing real people in relation to cost of living. Secondly, we need to be maximising those trusted relationships where we've got them. So there is significant stigma attached to poverty amongst some community groups. So really working out which of our various organisations, whether they're statutory or non-statutory, have those trusted relationships and therefore can engage and support individuals. Then I think we obviously need to build, bring together our kind of collective brains and heads to think about how to resolve this and think about the ideas. And then, of course, we also need to bring together our kind of collective resources in terms of the response. So I think we really need to think about this as a partnership and maximise the benefit of working as a partnership to respond to this. Already there have been some benefits so over the summer, while we're launching the kind of more formal cost of living system group next week, which is thinking about a medium-term response, through the summer we pulled together a kind of a group to look at a more immediate response to cost of living pressures. And already from doing that, we found benefits of just sharing information about what is available. And there's been some really good opening up of communication networks across our different services, just so that we can share with our frontline staff what is currently available and start to empower all of our frontline staff to be able to give more advice to the people that they are dealing with on a day-to-day basis. So I think that's already having some benefit, and there's much more we can do with that. But I definitely think, support everyone, thank everyone who's been involved in the partnership work to date. And I think this is something where we should really maximise the benefit and from the partnership structure that we've got.
Thanks, Nina. Mary.
Thank you, Chair. Thank you, Sonia, for your report. I just wanted to ask a question. It was in relation to section 4 of the report, where it talks about tools for frontline workers sessions. It would be really interesting to know how many frontline staff have actually attended those sessions and how that information is shared, because I think that information is going to be so useful, particularly for staff who are dealing with patients, linking back to the output from the Health Watch survey and the work that was done there in relation to long-term conditions. And when you've got a captive audience, being able to kind of share with your population or your patients, your service users, what's available out there. So I'm quite interested in how we find out how many health workers have attended those sessions, just to make sure we're capturing everybody that we need to.
Thank you, Mary. I don't see any other contribution. I'm just going to come in off the back of that and build on it. There's obviously the work with discussions with the voluntary sector and VCH Hackney about volunteering as well in that context, and kind of taking some of the lessons of the COVID champions into this work as well. So there's that, the point that Mary's directly made, but the sort of pathfinders and leaders within the system, and how we're going to work through that, because that's also the signposting confidence that Sally talked about. And then there's the group that's being convened, the system group, that I think sits with Nina and Sonia. Is that where the sort of direct accountability for where this is sort of working is going to go, in terms of the partnership with the NHS, and then the poverty reduction sort of framework cabinet group is going to have the oversight within the council? Is just to explore a little bit about, you know, the impact, especially of the investment and that work. I don't see any other sort of contributions at this stage. The only thing I would just highlight is energy has come up in every conversation, and I'm not entirely sure. I know you referenced, Sonia, that the ongoing work, we've launched a community energy fund, but that's not a solution to individual energy advice. The Green Homes Fund comes back for a third phase in January. That's about domestic retrofit, but that's not the same as the sort of hybrid handyman energy advice type work going into people's homes when they're at risk of turning off their heating. So I do wonder whether there is something in that territory that we want to explore a bit further. We completely acknowledge we haven't got all the answers at the moment, but it seems to be something really strong coming out of this afternoon. Thanks. Over to you. Sorry, big question, Sonia.
Oh, thank you very much. So in terms of embedding the principles, I'm really glad you raised that, Deputy Mayor Bramble, because that is a lot of the work of my team in terms of trying to get people to work. And when I say my team, I don't have a poverty reduction team. I mean my policy and strategic delivery. You know, the people who work on strategy there have been moved to focus on this, and that's a lot of the focus of the work, and it is quite hard work. So people tend to look at delivering solutions from a singular service perspective, and then we have to try to say, but if you send that message, or you design it that way, or you deliver it that way, then that's not going to meet the needs in the community that we have. Particularly, we've talked about some of those multiple needs. So the principles in the poverty reduction framework, there's a whole section in there. It's summarised at the end of the report I've provided, but the full draft is obviously available online. If you Google poverty reduction Hackney, it will come up, our page will come up. And that talks about being trauma-informed, poverty-informed, strength-based, anti-racist, valuing the insights that are in the community. And those might all sound like buzzwords, but actually what we're trying to do is put that into practice on the ground in the way that support is offered. So that means immediately having to work with a diverse set of community organisations, recognising that we need to work with those who have the trusted relationships, as Nina said, rather than trying to do it all corporately or centrally, and being, you know, strength-based, kind of recognising the way people's lives work, who's actually around them. It doesn't mean telling everybody to be strength-based, you know, but how that, what that actually means. But I think the more that it can be emphasised at system-wide level, why that matters, the better. So it doesn't just become, you know, because then we can move to working more effectively rather than having to have all of those individual conversations, rather than that taking up a lot of the system-wide group plan. Like, you know, coming back to accountability, in terms of updates being accounted there, we don't want Nina's time to be taken up with simple questions about ways of working that should really be shared and taken as given. And then that brings me on to Sandra's point, which is absolutely, that's why we're trying to surface what's happening. So there's already something being commissioned around energy advice. That's not going to reach people if it's just advertised on a website. But as I've put in as I've summarised in the report that's provided under community partnerships, we're still working with all of those community organisations and community settings. So actually, it's and there's 2 people who've been recruited who sit in my service, but whose role it is to be that glue, to work across and to try to join the dots and connect in a very practical way. So they would be tasked with then thinking about where the opportunities are to take support into community settings where there's already residents. And again, that very much, as Sandra said, it links to your point, Councillor Bramble, the point that you'd already made. Sorry, I'll just go back to my notes. So then, in terms of so then the tools for frontline workers, Mary, it's actually dozens, if not over 100 that are attending, and the meetings are recorded. I can provide the information through Peter and Donna of the person to contact. It's open to any frontline worker. Every week there's a different topic. So energy advice is an example where we've been looking for who the right person is to bring them into that meeting. And we got that going over summer as a quick win, something we could put in place quickly whilst we were working through all the governance. It's every fortnight on a Thursday. And so I can circulate those details. I can get more information about precisely who's attending at the moment, but it is different people each time. But it is about building that, and I mean that goes back as well.
Interrupt, so just for that's open to anyone within the system. You can be a VCE.
Yes, and it is attended by a really diverse group of people. I think members have probably attended more than I've been able to.
Such a wide range, over 140 people.
And that goes back to embedding the principles, because actually the idea is that you make it real. You get a group of frontline workers together, and then you can do more to embed the changing practice into that work. But you need to equip them first with the information. You can't just say you have to work these ways. You know, you need to start by building that confidence. And obviously that can be done with the front line, but it also does need to be reinforced by leadership across the system. And then the emerging theme about energy advice. So as I was listening, I messaged Jenny and my team just to find out where we were, which is why I found out about the support which has been procured. But I agree, Chair, that we need to look at whether that's enough. It's certainly, I think it's not just about energy efficiency, but it's about advice about the best way to keep warm. Is it cheaper to have an electric blanket, or those sorts of questions about keeping the body warm. So those are areas that I agree are an area, as well as just practical looking at how we can increase support around fuel. But all of this is the art of the possible. There's not, just to remind people, there's no money this time from central government. There's a household support fund which is summarised, but I was working out that's probably about £160 per. If you think a third of our households are in poverty, that's probably £160 a year. So it kind of brings it to life, the importance then of tapping into the resources that are there already, getting everybody to think about how they can make their work framed by thinking about cost of living and poverty informed. Did that cover?
I think it did. Sandra wants to come back in, conscious of time, so last yep. My point just on the money, I've just been consistently reflecting on the universal credit £20 and how that took £35 million out of people's pocket, and whether you cut the household support fund, our own investment we're going to announce tonight, it's less than 20% of what was taken out, and the situation has got worse since. So it is always going to be impossible to bridge that gap and also get that balance between funding the support and the infrastructure that delivers it and the actual money, whether it's a food voucher or a fuel voucher that's going into someone's pocket. Sandra.
Yeah, thank you, Chair. So absolutely, Sonia, I agree that this is not a short-term thing, and actually it's going to take time, but I just think that there's a bit of a crisis response that we need to think about just for the winter particularly, in the event that there are either power cuts and or very severe weather, and how there will be particular individuals among all of that third of our households who are in poverty, who are going to be especially vulnerable in that circumstance. And so I'm just wondering if it's the same group that needs to come together and think about how do we target some support to those people within the resources that we have. And that would, of course, mean knowing who they are and being able to share that information across various agencies.
Thanks, Sonia. Sandra. Sonia.
Yeah, my suggestion, and I think there needs to be winter planning, and then there needs to be this work, and then you need to look at how the two align. So it'd be interesting, colleagues who are involved in that winter planning exercise. I'm not saying they're completely separate, but that's important to do separately. So, but just to be clear that we are, like, since summer, we've recognised the worsening crisis, and what I've presented to you today is where we are with the accelerated crisis response. So I'm saying, to some extent, we've had to park some of the aspects of the poverty reduction framework and focus on that third objective and do much, much more than we might have even envisaged 6 months ago.
Thanks. I think there's something on the edge of those 2 points around sort of emergency planning, if there were power cuts, if you were trying to create respite in a very clear incident like that, is slightly different, isn't it, than the resilience bit and the kind of the things we've been talking about. So, and we've seen that occasionally when heating systems have failed in areas of the borough where we've had to open a respite centre, and I know the Warm Hubs work is sort of ongoing as a network of places already that are in the community, but there's something slightly beyond that, I think. We're happy to leave that there. I'm sure we will return to it both here and in other forums, and there's obviously a clear governance around the poverty reduction framework and its sort of contemporary work in this space as well. Sonia, again, an update on the development work around the strategic plan, with the caveat the strategic plan is still in draft and heading towards Cabinet and Council at the end of the month, and I've got a draft and others might have drafts of it as well, but I know the overall envelope is something that we've been talking about with partners in different places, and I know that this is one part of a deeper piece of work that you and your team have led. So over to you.
Thanks, Chair. And for that reason, you haven't got a full draft of the strategic plan because it is still under development and it's very close to being finalised. So it wouldn't be appropriate to bring it here in the current form. But what the report sets out is why we've got a strategic plan, some of the the context that we're dealing with right now, and also going back to the point about principles and ways of working, some of the ways of working, some of the priorities for partnership working. So the strategic plan considers the council's role, but with a wider operating and external context, which is why we've moved away from the idea of a corporate plan, very focused on our own delivery, to that wider frame. And it very much picks up on the themes we've been talking about, the reasons why we need to work that way that we've covered in the previous item. So we've set out key political corporate commitments for the next 4 years that will be reported on annually. So residents and stakeholders can hold us to account, but it also does set out the values, the ways we'll work in partnership, priorities for change, and the issues for the workforce. And alongside that, there's been a separate piece of work to talk to individual partners about partnership working, their experience of working in partnership as a council, with the council. And there was a community strategy board meeting, which we really kept as a holding space during the pandemic. It was due to review, and the Mayor brought together members of that partnership last week to talk about how we might disband that group, or we will disband that group, and actually want to work more with the existing boards that are statutory on shared cross-cutting issues. So that means then that when you look at the strategic plan, the ask is also about how you could own parts of it or drive parts of it, and then how my team who were supporting strategic, that strategic partnership, how we all more explicitly put our effort into working with colleagues who form these agendas, and making sure that they cover all of the cross-cutting issues, and particularly looking at it from the perspective of issues that might get dropped. They're not one, they don't belong in one area. Although I recognise the Health and Wellbeing Board is itself very all-encompassing. So the key points to draw out in regard to how this relates to the Health and Wellbeing Board. I wanted to make the point that there's in both the poverty reduction work I talked about and in this document, there's a lot of cross-referencing of how we need to work more in localities and the neighbourhoods work and place-based approaches. And so I just wanted to make that point that's referenced, and obviously dynamically links with how we might work in neighbourhoods. There's the clear crossover with health inequalities, and it's stated in the current draft that the wider determinants cannot be addressed through looking just through the lens of health or well-being, and so the whole strategic plan needs to be seen as supporting health and well-being and the priorities for tackling the wider determinants. There's obviously the particular strategy, health and well-being strategy priorities, which are referenced in the strategic plan and reinforced. And again, the strategic plan can help us think more widely about how people thrive and about the drivers of mental of poor mental well-being that need to be looked at through the work that the strategic plan can try to do, the links to inequality in housing. Social connection, there's an opportunity to map what is already committed to across the it's a council strategic plan, but it picks up what's going on across the system, and more to do to share policy understanding why this matters so much to have good connections as an individual and in your community in a preventative way, and how we've learned so much more coming out of the pandemic. And then on financial security, as I said in the previous item, an opportunity to really fundamentally see those as the same and linked. I mean, in terms of where I just can see where the Health and Wellbeing Board might take a particular interest. I talked about social connection, but just the wider think about community wellbeing and what that means. So cohesion, Hackney has good levels of cohesion, but they are under strain. There's reports, for example, of people outside food banks, sort of being resentful. Those are things that we haven't necessarily seen before, and how they impact on population health and the like. It might be a theme. I suppose I'm trying to pull out the themes that are in the strategic plan that really do need a bit of a deeper dive. Employment, we've talked about in-work poverty already, so the impact of in-work poverty and what works to support people, which will have to go back to benefits and the benefit system as well. Serious violence and how we ensure that we're embedding our understanding of what drives serious violence, all of the factors, and looking at that from a health approach and seeing it's a public health issue. Health inequalities is already, it's already something that the Health and Wellbeing Board is looking at, led by Sandra, and there's a lot of cross-referencing the strategic plan to the work that's been going on there. We talked about long-term conditions already. So again, a deeper dive into the preventative work that can be achieved through the strategic plan, but that can really work backwards to what makes good health, and linking to work that's in there about aging well. Again, place-based working, getting people physically active, the walking commitment that's in the strategic plan. Climate change, you've just had a session in September, I think, about the links. So how that's taken forward. And then early help, early years as a theme that's also a place-based priority. So I'm sort of trying to pick up the place-based priorities as well. So children, long-term conditions, and mental health. I'll stop there.
Thanks, Sonia. An almost impossible task to cover the journey to the strategic plan and the comprehensive nature of it, and have a discussion in 15 minutes. But I think the way that you firmly linked it to the priorities of the Health and Wellbeing Board and our strategy, I think, is really well made. So there is a recommendation to the board to note the council is developing a strategic plan that will be taken to cabinet for adoption later this month, to note the key issues that are seeking to address. But I still think there is something about what there could be an enhanced role here for the Health and Wellbeing Board, especially around those shared areas. I do think we can see the strategy reflected in the strategic plan, but it's how we continue to breathe a life into it. And with the disbanding of and the focus on the existing boards, we can really have something substantial here. I just don't know if any steers on that. Anything else that people want to add? Politicians in the room get other places to have this discussion, so I'm just keen for others to come in. Nothing. Okay. No. Everyone. Hey, there we go. Sandra and then Nina. Sandra.
Thank you. I think we were all a little bit confused by the talking we could hear. It's not that we're not interested. Thank you very much, Sonia. And I really welcome the opportunity to bring health and wellbeing into the community strategy, and make a very firm connection between the health and wellbeing strategy and the community strategy, and of course offer support from myself and my team to help develop that as you work through the strategy refresh.
Thanks. And the contribution that public health can make, I think, is enormous. So welcome that. Mary, no, Nina, sorry.
I was going to say, firstly, thank you to Sonia for making a real effort to kind of engage wider partners on the strategic plan. I think that's been really valued. And I think as you get to a clearer picture and it's taken through committee, continuing to engage with partners on it will be really important, because there's a huge amount of crossover in terms of our kind of joint ambitions for Hackney. And I think we all recognise the role that LBH play as a kind of a wider leader of the Hackney partnership. I think definitely, as Sandra just said, there needs to be a really strong read across between the strategic plan and the Health and Wellbeing Board plan. There's so much overlap in terms of what you're trying to achieve. So I think as the Health and Wellbeing, in the next item or in a later item, we're looking at one element of the Health and Wellbeing Board strategy and a resulting action plan. And I think it would be really good to see through that work, that join up of how there's an alignment, and how the Health and Wellbeing Board is driving certain elements of the strategic plan, and kind of vice versa. So I think that read across is really important, and hopefully we can. I think Sandra's offer of taking that forward, and with your team, Sonia, really welcome that as well. And likewise, that join up and read across of the kind of Hackney strategic plan with the partnership board, the City and Hackney Health and Care Board, I think will be really, really key as well.
Thanks, Nina. Paul.
Thanks. It was just a very brief and hopefully not obvious point, but it was just also to really welcome, I think, the potential for really joining up with some of our kind of corporate responsibilities as wider organisations in terms of community cohesion and everything that we can hopefully, I hope, bring as partners to this work.
Thanks, Paul. I really welcome that. It was very short and very sweet, but very vital. And I don't want us to jump around the agenda, but I think it's also referencing in these two documents we're discussing and how that influences the integrated care strategy development that we're going to come back to later on, because we also know that the financial security element, the poverty reduction bit, is very important at the now level. I'll come back to you, Sonia. I did think there is something about just re-emphasising mental health, social connection, financial security and everything that we do, and a bit of a challenge given the budget work that we're doing at the moment within the council, how we're aligning that to strategic plan, how we're aligning that to policy-based budgets and impact, is making sure we recognise that in very difficult, tough financial times, despite all of this partnership, the dangers of retrenchment under financial pressure and the bits that suffer are partnership, sometimes the work that we do in the community, and things like reducing social isolation, because that is sometimes seen as nice to do. And I think we've learned the hard way in the borough that is more than nice to do, it's absolutely essential. Back to you, Sonia.
Yeah, I mean, just to say that we have been heavily involved in the next steps on the health and wellbeing strategy, so grateful for that. So I haven't necessarily directly done it, but lots of people from my team have been involved to ensure that join up between the strategic plan and this. But obviously the strategic plan isn't also situated in you know, we're in my team alone. So actually I think the bigger question is how we can work together to get the a wider set of people from the council as well engaged, and see the strategic plan as an opportunity to get more people engaged in the important, the cross-cutting significance of health and well-being. And I can see that in the paper that's coming on the update health and wellbeing strategy. And in terms of the point about finances, whilst there isn't going to be additional funding, and that's very clear in the plan, and if anything, we're facing, as is very clear in the full version, but also in the challenges section of the report that I've provided, you know, we're facing very, very difficult, a very difficult financial situation, as you all know. But I think in that context, then, the importance of the strategic plan becomes about, first of all, how we can make sure that when we are having to make decisions about savings, we're using the plan and what matters there to understand the full impacts of what. So that's the first thing. And I have already talked to the Director of Finance about making sure that we do that. I mean, we do support a cumulative impact assessment of budgets, but actually with this new plan, it helps, you know, we can really make sure it's in that wider frame. And the second point goes back to something I said in the previous item, which is that whilst we may not have new funding to do something around, say, social connection or mental health, the plan can help us to make sure that what we do deliver values those, you know, values partnership working, values that, and also understands the disbenefits properly if you don't get it right. So if you make a decision that you think is okay and justifiable, but you haven't thought about the impact on social isolation, or you haven't thought about the impact on mental well-being, then it's, you know, it allows people to think about benefits and disbenefits in a wider frame, because some of the decisions you can make, it might impact disproportionately on people's mental well-being in a way that then, you know, the costs are being picked up somewhere else in the system, so they're still there. So those 2 points would be the most practical things we can do in response to that.
Ferocious nodding from the chair, so thank you, Sonia. Are we content then with the noting? And I should have said under the previous item, we provided the feedback and obviously noted, I think, everything. So we content? Great. So all part of the theme. Moving on to the health and wellbeing strategy action plan update, and I think Sandra and Chris is down to lead on the progress of developing the action plan. We'll be asked to consider the update on progress towards a final joint health and wellbeing strategy, to approve the approach for mental health improving mental health and increasing financial security. And there's a question for us around social connections in the action plan. Do we want to set actions, or do the board want to set ambitions and ask partners and groups to develop our actions in a broader way? Over to you, Chris, unless you want to just add anything in interest, Sandra. Right, it's Chris.
Thanks very much, Chair. And just to introduce myself, I'm Chris Lovett, Deputy Director of Public Health for City and Hackney. I think you've almost taken everything I was about to say, Mayor, and said it already. So, but just to kind of present that there are three things that we are looking for the board's approval on. The conversations that have just taken place around the financial security, I would suggest almost answer the question that there is so much work already being taken place, and the connections that have already been made across the partnership, I think does almost answer that question that's in this paper, which is, are you essentially content for those work to continue as part of the poverty reduction system delivery group, so that the explicit focus that we have in the health and wellbeing strategy is actually taken through that work. So that's the kind of one of the first questions that this paper is kind of formally putting to the board to consider. And then the second one is in relation to the work around mental health, and mental health being the first strategic priority of our action plan. And again, it's recognizing that what we have at the moment is quite a lot of strategic plans being renewed and action plans being developed. And the proposal here essentially is that for the Population Health Hub to work with the existing strategies that are being developed, so that we have got that slightly broader focus around mental well-being, mental health promotion, as well as the focus on reducing increasing access to acute and community mental health services. So those are the kind of the first two kind of propositions that the paper puts. And then the third one is actually reporting on the work that we've undertaken around the social connectedness priority. So we did have a workshop. It was very well attended from across the partnership. And essentially what has come out from that workshop essentially is a request to the board and options really that the people at the workshop felt it would be probably important for there to be a social connection champion in each of the health and wellbeing board members, reflecting upon the comments that were just made, that in times of financial hardship and austerity, often this is one of those areas that may get deprioritized. So actually requesting each member organisation to nominate ideally a senior person who will actually have that as part of their role and being part of the membership of the Health and Wellbeing Board, and then actually the fact that they will work together to produce that detailed action plan around the actions that are going to taken for social connections, to improve social connections. So those were the comments I was going to make really. The paper I think is detailed and comprehensive about the reasons for those proposed ways for us to take forward the action plan. So just in summary, essentially remitting the work for the Population Health Hub to lead on within the existing poverty reduction work, and then again for the Population Health Hub to work with the mental health colleagues around the development of that action plan, and to make sure it's broad in its focus, as I think was the aspirations at the time that we set the mental health as a priority for the Health and Wellbeing Board, and then those options that are detailed on the paper in relation to how to take forward social connections. Happy to try and answer any questions.
Thanks, Chris. Just for the benefit of everyone, 30 seconds on the Population Health Hub and what that actually is, and might be useful for some of the lay people here. I know I've obviously seen quite a lot of it referencing in different pieces of work. And then the second part is, I guess, silence turns into consent for your proposal around the reducing social isolation and the nominated people. I suppose we then just need to, if we do agree that and everyone nods it through, then each individual organisation does need to come forward. And I suppose we're going to need that collective effort and probably colleagues that are here to help chase that through. You're 5 minutes behind Deputy Mayor Bramble, Jackie, so of course we know you've got the scores for them. And then the only bit of nervousness I have is how we measure impact. So, you know, what should we be looking out for in a year's time to show that the the strategy and the action plan are delivering a way of working without getting into a lot of KPIs and indices. It's just what would show us here that adopting both the strategy and the action plan is starting to have an impact on the ground. Those are my questions. I don't know if anyone else has any comments or points wants to come in response. Sandra.
I think Anna will probably cover your questions as she presents the paper, but we can return to those if not. Sorry, I actually thought, but she looks like she's not here. So I actually thought that we had somebody else to do a bit more detail on the paper. So so to respond then, the Population Health Hub is one of the groups that enables the local place-based partnership integration functions, and so I'm the senior officer, but we have people from both NHS and local authority who work in it, and it provides support in terms of delivering improvements in population health, so to particular organisations or services, so that they can understand how to think in a way about populations and not just about individuals, so that they can design, develop and deliver their services in a way that actually is about improving population health and reducing health inequalities. And that includes providing tools, support, evaluation support, etc. So the hub has taken over developing the action plan, implementation plan for the health and wellbeing strategy, and that will include alongside it an evaluation plan, which will help us to know, to answer your second question, whether we're on track in terms of delivering. So in a year's time, we may not have had much delivery, but we'll at least be able to say, this is what we've done and this is what's in place. And then subsequently, we'll be able to say, so this is how we're monitoring against each of the elements of the implementation plan and what progress we're making.
Great, thank you, Sandra. Nina? You're on mute, Nina, sorry.
All right, there we go, sorry. Thanks for this, Chris and Sandra. I completely agree with your proposal around the first two objectives around mental health and poverty reduction. I think in terms of your question on the increasing social connection, I think I really like the kind of overarching objectives that you've set out of what you kind of expect to see around increasing social connections. In terms of the action plan, I do think there should be an ask to different groups and partners to contribute what they would be doing to support those objectives. I think that's a way of getting more engagement from partners, more engagement in the action plan, and also it might present things that we hadn't thought about. I kind of worry if we send out this as an action plan, a lot of partners might, I don't know, I just worry it won't work from a kind of engagement point of view. I also think there's a risk that then this group gets quite bogged down in tracking a very detailed action plan when it could be, other groups could be, or partners could be looking in more detail at tracking kind of detailed actions, but then reporting against those broader objectives and outcomes as well. But thank you for this.
Thank you. Susan.
Thank you. As you'd imagine, I really welcome Objective 3 here in terms of recognising the resource needed by the VCS organisations to deliver relevant programmes and consider funding those accordingly. I also really welcome the praise there for the Connect Hackney programme, which has ceased in its sort of previous form. And I think that that's my cautionary note, that there are still fantastic programs that are being run in Hackney that sort of do a great job of sort of connecting people, like lunch clubs, which then go back to, you know, the conversations we were having around the cost of living crisis and providing hot meals and warm spaces and bringing people together. So I just think, you know, objective 3 is something we really need to sort of keep in mind. And I realise, you know, how challenging the climate is at the moment for councils and the NHS in terms of funding, but that's my point.
Thanks. And the point about lunch clubs is very understood in the room. Lorraine, you had your hand go up and go down. I didn't want to completely ignore you before bringing in Lauren. I am conscious of time, so I will take you back to back if you do want to come in, Lorraine. And then I think we can take as read, really, these contributions as feedback rather than come back in detail now. Lorraine, or are you fine?
Yes, thank you. Thank you. So I suppose for me, the only thing that I thought we need to probably amplify is how do we co-produce this? Because there's something about how we measure loneliness, if there's such a word, but also what works with different communities, considering how diverse Hackney is. I think there's so many target groups that have been placed there, but I would suspect there may be more where people are isolated, maybe because of language barriers or other things as well. But it would be good to think to amplify how we co-produce this with residents, so that we're not doing to, but doing with. And then through residency, how we measure whether this is having an impact or not. Thank you.
Thank you. Last point to Lauren.
Hi, so I'm from the Volunteer Centre, for those who don't know me. Yeah, I just welcome Lorraine's point. Absolutely, it's quite difficult to measure reduction in loneliness. We're still trying to master that one. But all our programmes, like Together Better and volunteering, obviously build connections, and we just do surveys regularly with residents, and we just ask them, have you met new people? Do you feel less isolated? And overwhelmingly they say yes. So sometimes the most obvious questions, sometimes are the okay questions, I think. I just wanted to raise awareness of our community befriending programme, because I feel like it's not really understood or appreciated across the system. At the beginning of COVID in 2020, our befriending programme roughly had around 20 matches, and overnight we started delivering training twice a week to volunteers, and over about 6 months we went up to 176 matches. We carefully train volunteers and we match them to people who are very isolated with complex mental health issues. As far as we know, we're the only befriending programme in Hackney City that actually supports people with complex mental health issues under the age of 65. And people over the age of 65 have comorbidity with very long-term serious health conditions. But it's way more than a befriending programme. Like, it's often seen as something where you just take somebody out, but actually it's all of those things that people have been talking about tonight, about building trusted relationships, signposting, helping link people into services. And they've saved people's lives, literally, because volunteers alert us to people who've got suicidal thoughts, they're not taking their mental health medication. We alert GPs, we alert serious mental health services, and we seem to be the service that all the mental health services are referring people to, because they're discharging them and they don't know where to send them, or they have really long waiting lists, and so they send them to befriending. And I just think it's really important, particularly when all these issues that have been raised, particularly around social connection. I had to ask for the befriending programme to be put into the action plan, because it wasn't mentioned at all. And I keep asking for where I can go for funding, because after March, we have a tiny, tiny point of money from Hobbiton Hospital to work with people with who are what they call frequent users of services. Otherwise, we get nothing, and I don't really know where else to go with it. And you're at risk, basically, of losing the service unless we can get some help.
Thank you, Lauren. You are referenced in the paper, but what you just said at the end was very important to us. I think in terms of that funding and how it's seen by the system. Chris, is it okay that we know that, especially the final round of points that Susan, Lorraine and Lauren made, and take that back? I think there is board support for the direction of travel. and the need for co-production. So it's co-production with members of the Health and Wellbeing Board are going to nominate people, but then it is also co-production beyond that with residents and some of the organisations, isn't it?
And I think it is balancing the fact that this has to be everybody's business, as well as wanting to focus on that action plan that we have developed. And absolutely, it will get further developed and looked at with co-production. But I think it is making sure that every organisation does have the person who we will look to be the link in, and then the link out to the Health and Wellbeing Board as to what has been delivered to reduce loneliness and increase social connections.
Thank you. So we will note that. Noted. Dr. Cooper and the City and Hackney Safeguarding Adults annual report.
Thank you. Can you hear me clearly?
Yes.
Thank you. Good evening, everyone. So this is the annual report of the Safeguarding Adult Board for City and Hackney for last year, for 21-22. And we are required to bring it to the board, so I'm very grateful for this time this evening. It was quite a challenging year, and I think the first thing I'd like to say is commending all partners for sustaining their responsibilities to safeguard adults in Hackney during the year. I'd like to just draw attention to one or 2 points. There was a significant increase in the reporting around self-neglect as a form of abuse, and that's quite worrying because it's continued to rise during this year. I think it's probably related to COVID and the lockdowns and the experience of COVID, but I think it's also now related to some of the areas of discussion already covered this evening in terms of the impact of the cost of living crisis, and we're needing to try and understand that more, I think, through the board in terms of the challenges that we face in terms of safeguarding activity. On a more positive note, we had really gone a bit backwards in terms of our engagement with people who use services, particularly their experience of safeguarding. And we've now been able to commission the advocacy project to get feedback from residents on their experience. And I'm hopeful that that will add to understanding how safeguarding work is delivered in the borough. We've got 3 safeguarding adult reviews that are being published this year that we worked on last year. And again, the learning that's provided from those safeguarding adult reviews is really important in terms of development and improvement. In fact, related, I think, tangentially related to some of the issues around cost of living. And I think if our fire brigade officers were here, they would raise it. We have been doing some work this year around fire safety because that's an area that we've had a safeguarding adult review, and there's particular challenges with fuel poverty moving forward. I think so. Finally, I would just like to say that I think it continues to be very challenging that adult social care pressures, the reforms that are being implemented, austerity, the market and workforce issues and challenges mean that the safeguarding, the lens that safeguarding puts is quite significant because what we see is the tip of the iceberg. So I am, I suppose, quite worried moving forward that we will see a change in safeguarding activity, not least because of the issues that have already been discussed this evening. So I wanted to flag that whilst the report is a annual statutory report, we are seeing evidence of the issues that have been discussed earlier this evening in safeguarding and in the Safeguarding Adults Board. We've used the board, we've got the poverty framework has been presented to the board, the poverty reduction framework, and we're using the board and the partnership to promote the actions and activities that are available through the partners of the board. And I think that's a really helpful contribution in terms of consistency with other partnerships and other areas of priority that colleagues have. So I think I'll just stop there and ask if there are any questions in terms of the board and whether they're, I'm happy to answer any questions, or whether colleagues, particularly Councillor Kennedy and the director, would want to contribute that. I'll hand over to them, really.
Thank you, Dr. Cooper. Councillor Kennedy, Helen. Councillor Kennedy.
Thank you. Yeah, I would just very quickly like to thank Adi for her work and Raina Griffiths, our lead officer, who is leaving us after very sterling service here. One particular piece of work of the board I particularly enjoyed was that where we looked at housing and antisocial behaviour and where it intersects with adult safeguarding. Some very good partnership working with colleagues in those teams. Thank you.
Thank you, Councillor Kennedy. Any other comments? I think it is sobering as when it came to Cabinet, the trends I think are very clearly articulated, the interactions with everything we've been talking about, including possibly some of the solutions to these challenges, or at least stopping them deteriorate further. Are there any other comments or questions on the report? Are we happy to note it? And again, I extend my thanks to the board as I did at Cabinet and to Dr. Cooper. Noted. Thank you. So moving on, we have the Better Care, just double check. Yes, the Better Care Fund 22-23 plan. And Mark.
Thank you, Chair. Good evening, everybody. Apologies from Stephen Fisher, who isn't able to. So I'm Mark Watson. I am a programme lead for the Better Care Fund at the Council, and Cindy's my equivalent at the ICB. Would just like to ask the board to sign off the plan for this year, 22-23. It's an odd time of year to be asking for a plan to be signed off. And that's just the way that the Better Care Fund national team produce their planning guidance, and hence that's why it's now November that we're asking for the plan. It's in the documents. I just wanted to take the opportunity to highlight a couple of things. One is that the plan's already been to senior officers at the council, NHS now, and the Homerton Hospital. Also the discharge group that does include experts by experience who support us, the housing needs and benefits team, the homelessness team, and the City and Hackney Health and Care Board. And just highlight the key priorities for this year for the Better Care Fund. It's to continue to support the delivery of the City and Hackney Partnership Integrated Delivery Plan, to help reduce health inequalities, to support the big ticket items for the Partnership Transformation Programme, to support or continue to support the neighbourhood work and the hospital discharge. A lot of the work for hospital discharge is funded through this, and particularly this year we're looking at doing a review of the discharge infrastructure. And that was really it to ask the board for sign off. Don't know if anyone has any questions.
Thank you, Mark. Did Councillor Kennedy want to jump in? My immediate response is always, well, whenever we discuss this, just how dependent we are on this funding mechanism. And maybe that leads into where Councillor Kennedy was going.
Chair, that's exactly what I was going to say. We have to say it every year because it's ridiculous that you're dependent on one-off tranches of funding to actually be able to deliver care across the system. We say it every year, but we have to say it back to government. It would give us so much better use of resources, actually, an ability to use resources and plan properly. If we knew just for, say, 3 years in advance what was coming into the system, we can't say it enough, because if we got that kind of certainty, we'd be able to do so much more, plan so much better, rather than having to do it in this piecemeal way every year. But this is a very comprehensive piece of work. Thank you, Mark and the team.
Thank you. Completely agree as well.
Echo that. Does this replace the when we've discussed it as chair, we're actually doing it in a meeting? Yes.
Yes, that's correct.
Excellent. So we're restoring governance and seeing it as a partnership. Excellent. I don't see anyone else coming in. I think you know, what you added to what I said, Councillor Kennedy, illustrates exactly where we are. Are we happy to approve this? Approved. Thank you, everyone. So moving on to item 12 is the North East London Integrated Care Strategy Development. And I think Emily Plain and Hilary Ross were.
Hi, yes.
Hi, Hilary. Sorry,
Hello.
you're at the bottom of my screen. Over to you.
Thank you very much for having me. My name is Hilary Ross. I'm Director of Strategic Development for NHS North East London, and I know that we are short of time on the agenda. It's been a really interesting discussion to listen into so far. So I won't repeat anything about the kind of process around the strategy or the positioning of it. That's all in your pack, although of course happy to answer any questions. What I thought I might do is just give you a couple of minutes on some of the kind of emerging themes that we think are going to be central to the strategy. This is a sort of a flavour of some of the feedback and the discussion that is shaping the strategy so far. And then I'm obviously really here and keen to hear from you about what you think will be important to have in the strategy. So first to say that the guidance requires that we do take account of JSNAs and align with local health and wellbeing strategies. And clearly a focus across the whole of North East London is around health inequalities. This is in all of our local strategies, and it will absolutely be a thread through our system-wide strategy as well. Really interesting to hear your conversation running through your meeting today about poverty. That has been coming out strongly in lots of the discussions underpinning the strategy as well. A growing recognition of poverty as a really key driver of health, and something that we need to be thinking about very clearly. It sort of ties in, I think, with your sort of focus around greater financial well-being for your population here in Hackney and the City of London. But I think also the kind of discussion about the wider determinants of health, but also the focus on employment and what we can do as through our role as anchor institutions is really coming across very strongly. As you would expect, the four system priorities around babies, children and young people, long-term conditions, workforce and employment, and mental health, again, are really going to be central to our system strategy. So it's really interesting to hear, you know, your conversations about mental health, which is obviously one of your local priorities here, but also that piece around social connectedness, which has been coming through in lots of our conversations, particularly after the sort of last couple of years and the social isolation that's been growing through COVID. We've been running workshops with stakeholders from across the whole system to help us think about how we progress these system priorities. We had a workshop just this afternoon with over 150 people from across the partnership joining us to talk about mental health, and heard some brilliant had some brilliant examples of lived experience that were shared as part of that process. We've also had a focus on the cost of living as well, building on the work that you and other places across North East London are doing to tackle the cost of living and thinking about some of the things that we could do as a system to help support that work, using our collective voice as a system to influence nationally and regionally, thinking about some of the specific pathways that we need to really address risks in, as well as thinking about our own workforce and not just the NHS workforce, but also our care workforce as well. So there'll be a lot more, I think, to come around that. But some other, just to finish, some other quick themes. So how we work as a system, I think very strongly people are saying this strategy shouldn't just be saying about what we need to do, but it also needs to talk about how we work differently together. This is very much about residents at the heart of everything we do, co-production, not just collaboration, being really clear about the really important role that the community and voluntary sector need to play to support us in this work. A really strong focus on prevention, including primary prevention, and how we can sort of have an integrated focus on prevention across all of our system. Personalisation, more holistic and integrated care focused on what matters most to residents or service users and patients. And then a recognition also that underpinning a lot of this ambition, we've got to get some of the basics right as well. Some of these basics that are critical for a well-functioning system. Workforce is a really key area that has been has come up repeatedly in lots of our discussions, whether in relation to our sort of 4 system themes or in other discussions, and also things like financial sustainability as well. So as I say, that's just a bit of a flavour of some of the emerging themes from a range of conversations happening across the system, but really keen to hear your thoughts about what you would like to see as part of this strategy. Thanks.
Thanks a lot, Hilary. And I'm not sure if you caught it at the very start of the meeting. I obviously declared that I'm on the ICS board, so I get to see this again, and the aggregation up of all of the outreach that you've done. And I do really thank you for staying and listening to the full meeting, getting a flavour. I think you've got a good flavour of the City and Hackney system by those discussions, as you suggested, and also the papers that you will have seen. I'm going to jump in with a few points and steers, if that's okay, and then I'll invite others. And I'm mainly focusing on the coloured boxes in the sort of slide 8. I think we believe that our sort of JSNA is an evolving picture and not always static. So I think that may not be the case everywhere. And the way we're approaching, obviously, the wellbeing strategy, I think you heard earlier, it's an evolving piece of work as well. So I suppose it's that, how can the nail work make sure that it doesn't capture a moment in time and harden it and allows us to continue that iterative work, I think is really important. Moving on to pink box, I'm really, and I will say it everywhere, reducing inequality in outcomes under those 4 systems priorities, not just improving the overall sort of performance of the system and access, I think is so important. Quebec and global majority outcomes in terms of maternal health in the baby and children area. In long-term conditions, I think Hackney's made some very clear positions around fluctuating conditions, the challenges of our population around sickle cell and HIV, and stigma related to some of those conditions. And I think you may be aware we've just recently passed a long COVID motion, so making sure that that's fully recognised as a long-term condition. Unusual cancers, rare and uncommon cancers, and I think again with the mental health work that we've sort of done, reducing that inequality is absolutely critical. I might leave the workforce point to others, and the sort of final point, I think, on behalf of the rich teams of VCS that were in the room at the start of the meeting and are still with us, is crucially that role of the community and the co-production. So again, we could have the best plan for the system, but if it isn't permeable and it isn't delivering resources into the community and voluntary sector in a way that's sustainable, then it won't also deliver. Equally, it's got a challenge as well. You know, we know from experience locally we don't always get things right in the way that we commission, and some of the ideas don't always bear the fruit that we would want, and we're very reflective as a system, but we still do really value the contribution of organisations like HCVS and VCS Hackney and some of the other organisations represented. That's probably enough for me. I'm only going to come back to you once, Hilary, sorry, just because of time. Helen.
Hi, Hilary. So really welcome you bringing this here. I think it's really helpful. Mine's probably more about the importance, I suppose, of place-based strategies and how that feeds in to the overall ICB work. So I think we've got quite a coherent strategy in City and Hackney, and as you've heard today, it links to the various other strategies so that we're not kind of tripping over ourselves. So there's something for me about how you can engage with the place-based partnerships to make sure that the overarching strategy kind of builds on a kind of bottom-up approach from the existing place-based ones.
Thanks, Helen. Sandra.
Yeah, thanks very much, Chair. So building on the comments from the Mayor, just picking up on the long-term conditions, I think that what would be really helpful would be for the strategy to be about principles around working with people with long-term conditions. And although there's some major conditions we want to flag because of the significant burden, if that's the right way of putting it, of disease associated with those, there are some relatively uncommon but also very significant ones that affect particular communities that are definitely worth mentioning, and the Mayor mentioned them, and I just think it's worth making the point so that rather than having a strategy that says this is what we're doing with diabetes and this is what we're doing with cardiovascular disease, but it says that we have an approach to working with people with long-term conditions and then name some significant ones. And then on the workforce element, just to remember the whole workforce, not just the NHS workforce, and not just NHS and social care, but the very significant contribution from the VCS means that they also need a workforce. And how do we manage to incorporate their needs and views into our overall workforce strategy for the health and care system, as well as thinking about that as part of the employment strategy.
Thanks. Thanks very much indeed, Sandra. Mary.
Thank you, Chair. So Hilary, thank you for that. And I just want to kind of follow on from the last comment, because obviously I kind of want to raise the issue about workforce, because I think the workforce is got to be key, because without a workforce across health and social care, we're not going to be able to do anything. And obviously including all the other support organisations, the voluntary organisations, the people who work in like community groups and so on. So we have got to really do something about that as part of the strategy. But I also want to pick up on what was said earlier about diversity and equalities, and not thinking about it just in relation to population health, but also thinking about it in relation to workforce and employment as well. It's got to go right across all of that. And then my kind of final point is around, whilst we're kind of considering the priorities within Hackney and obviously the NEL priorities and the place-based system priorities, what we mustn't do is forget about the priorities that are going to come left field from NHS England, from the Department of Health and Social Care, from Health Education England, and anybody else who's out there, because what happens is it derails what we try to do locally if they've got other things. So we've got to try and dovetail it all in, so what we're doing meets our priorities but also equally meets external priorities as well. Thank you.
Dare I say, incredibly well put, Mary. Thank you. Susan.
Thank you. I kind of feel that the chair and Sandra have done my job for me in this particular part of the meeting. But I'd just like to stress that I really do think the VCS are a gap in the NEL workforce strategy. I went to a workshop looking at this very particular area because they had a workshop devoted to the VCS, and then we were invited to a general NEL workshop on the workforce. But when we got there, we found there was absolutely no reference. You know, up on the wall they had posters breaking down primary care workforce, social care workforce. We were nowhere, and I mean, basically, I think there's a problem with equity, that people in the voluntary sector are paid less money for doing the same jobs that exist in the NHS and in local authorities. I mean, one thing that was identified as a fairly simple win would be to sort of open up the training that's available within the NHS, within local authorities, to the voluntary sector. But we really found this was a blind spot. And I mean, we'd like to think that at the end of the workshop, it was made very clear by the voluntary sector organisations and CVSs in the room that this was something that would need to be sort of taken on. But we wait to see.
Again, very powerfully put, Susan. Councillor Kennedy.
Thank you. Yes, I really welcome what both Mary and Susan have just said. I'd love to build on that. So that training, yes, should be available for the VCS. It should be available for volunteers. It should be available for unpaid carers. Because there's a workforce doing an incredible amount of lifting there. And when you say workforce, please include all of them. It was lovely to hear you, Hilary, talk about co-production. And when you get co-production really right, and it really is from grassroots right down at that level where you've got that need, and that's where you are co-producing your solutions, then you don't get knocked off track by those outside targets that Mary was talking about that come in, because you're resilient enough and you're close enough to the people you're delivering the service to be able to hold on to what you actually want to deliver for them. Thank you.
Thanks, Councillor Kennedy. Just that last point was the point I was going to make, that everything we've just discussed here, we completely recognise the challenges the NHS face. I'm on the finance committee, but losing sight of everything we've talked about today because we become just focused on the sort of control totals, the finance challenges and the acute challenges. I think we miss that opportunity around prevention and obviously reducing ultimate cost and crisis within the social care and health, where the cost is as well. And so, yeah, I think Councillor Kennedy put it better than me. So I'm going to go straight back to you, Hilary, and thank everyone for their contributions in the room and virtually.
Yeah, no, and I just add my thanks as well for all of your thoughts. And I think we are obviously up against a really tight timeline for producing this initial sort of interim version of the strategy. The timeline is based around the need to provide some direction for the new NHS 5-year plan, which has got to be produced and submitted by March next year. So I think we recognise that this is you know it's we're trying to work at speed here, but I think it's also really important, and it goes back to the point the Mayor made at the beginning. I think what we would like to see is this is a dynamic process and not a one-off kind of conversation and then a document that sits gathering dust on a shelf. It's about how do we create this dynamic process where we're working together on system development, learning, and improvement. All the points you've made, I think, are really, really well made, and they chime very much with what I'm hearing elsewhere as well. Just on the workforce piece, so we are required to develop a workforce strategy. So that is that we're in the early stages of that work at the moment. What we will do is set out some of the principles in the Integrated Care Partnership Strategy, and then a strategy specifically around workforce and employment, including local people in employment, will follow in the early part of the new year. We're also linked to that, working on the development of a collaborative across the community and voluntary sector, so there'll be more to share around that. And all I can say is I completely agree with lots of the points that you've made, and we'll look forward to sort of talking to you more about all of this in future discussions. Thank you.
Thanks very much, Hilary. There's a small bit, obviously, I don't like describing the workforce as enablers to making the system work, but they are obviously the heart of it. But there's also the sort of data sharing and sort of with partners, which is probably just as important as well. But that's my final remark. No need to come back. And thank you very much, and look forward to seeing it in its future iterations at the main board. And I hope that other feedback from other health and wellbeing boards aligns with what we've been sort of saying here. We've reached the end, and remarkably only 5 minutes over, given all the topics that we have discussed. So I really do thank, and I think everyone's voice has been heard, which has been incredibly important as well. So we haven't rushed through that. I wanted to draw everyone's attention to the next meeting. It's on the 26th of January 23. The theme is around children and young people. So especially for that community voice section, making sure that we're giving some really detailed thought to that. Nothing remains for me to say than to wish people that are celebrating a happy Christmas in November and a happy New Year, and we'll see you in 2023. Thank you.